Well, good afternoon, everyone. I'm just so thrilled to be participating in this webinar and see the number of attendees sort of go up, and we have over 100 participants and counting. Rural America, specifically rural communities in the Central Valley, are negatively reflected in many indicators of poverty, prosperity, and health. Poverty is one of the fundamental causes of these health inequities across the Central Valley, whether it's disproportionate access to medical care in rural and impoverished communities, or food deserts in low-income and working-class communities that lead to increased rates of heart disease or diabetes. A few years ago, hard to imagine how time flies, I was sitting next to this amazing person, Dr. Kathy Murphy. You see, Dr. Murphy is a pediatrician from Valley Children's Hospital. She has a big heart for children and a very big heart for our community. Kathy started engaging me and talking with me about some of the health inequity problems in the Central Valley, as well as the impact of these problems on vulnerable communities, including children. She spoke about needing to bring our leaders in healthcare, our leaders in education and policy together, and together to address these problems head on. Through these conversations, we came up with the core academic partners that formed the academic hub of this collaborative. I feel such a sense of friendship and kinship with these wonderful women who are great researchers, great scholars, and humanitarians. From UC Merced, Nancy Burke and Irene Yan. From Fresno State, Tanya Pacheco. From UCSF in Fresno, Serena Yang. I remember all the conversations in the beginning as we were building the plane, as we were trying to fly the plane. So what does HEAL mean? Health, equity, and learning. The word HEAL is very powerful. It evokes a feeling that things will get better, things will get stronger and more vibrant. And we definitely need that these days. Our very first event was most appropriately in the rural community of Delano, November 15th, 2019. We had individuals from 6 counties flock to Delano, where we heard from Congressman T.J. Cox and many, many others. There was so much interest from policymakers, from doctors, public health leaders, social workers, educators throughout the Central Valley. In fact, we went national with the webcast of that particular convening. Individuals who cared deeply about improving access and attention of resources to rural communities. Rural communities right now, a rural HEAL right now, we're focused on 3 major priorities: to develop and scale regionally high-demand, high-wage pathways in education and health sciences. Number 2, establish programs that meet rural workforce development needs. And 3, focus on advancing rural health equity and well-being to improve social and economic mobility of families in rural America through the lens of research and community outreach in California's Central Valley. In the years since this collaborative was founded, the COVID crisis has highlighted how these regional inequities disproportionately impact the San Joaquin Valley. And I know our speakers today will shed some light on the ways we can alleviate the burden on millions of Central Valley families, on Central Valley children. Now, to recognize those who put this event together, certainly from BC's Public Health Department, Dr. Charles Daramola and Professor Lisa Villanueva Thank you for engaging our community through the public health work that you're doing, including our partnership with Centric Health. And also wanted to do a big shout out to our contact tracing class. I understand that we've filled several sections of that particular course. It's completely online and available. It's just a short class. Thank you, Shantan, Norma Rojas Mora, my friend Cindy Collier, for all the work that you've done to pull this together. Thank you, Earl Parsons. And thank you to the amazing Marbella, the quiet force, who dotted every I and crossed every T to make this webinar happen. I want all of you, all 132 participants, to stay till the very, very end. Dr. Murphy will unveil the innovative legislative work happening in Washington, D.C. This proposal that she will speak about elevates policy and requires all policy to be evaluated through the lens of equity. Without further ado, let's get the program started.